Welcome back to Living Local. 1 in 5 adults and 1 in 5 children in our country experience mental health issues. And in some point in almost anyone's life, they will experience a mental health crisis or challenge. Mental health awareness is on the rise, promoting that there is no shame in talking about it or seeking help. Joining me in studio is Dr. Vincent with Southpark Psychology. Thank you so much for being here, Dr. Vincent.
Of course, good morning.
So what is the history behind Southpark Psychology?
So originally it was founded approximately in 1984 with Rip and Beth O'Keefe. They ran the clinic here in Moline, and I joined the clinic in approximately 1995. From there, I took it over 6.5 years ago. There was about 13 people at that point. I took it over 6.5 years ago, and from there it's expanded to right now, actually 24 of us. Opened a second clinic 2 months ago. And within a few months there will be 26 of us. We have expanded our services to include testing and soon to include medications by the autumn.
Wow, that's great that you guys are expanding those services for people. What is your personal experience and background with psychology?
Well, I've been a professional psychotherapist since I was the age of 26. I'm now 48. I've been trained primarily in America. I've also had education in Britain. I'm British, and so I worked primarily at Trinity Medical. 13.5 years ago I joined Southpark. I was an examiner by trade at the hospital. All my office-based therapy has been here at Southpark. What can I tell you? Long career, treating many different populations.
Definitely. And what kind of services are you offering at Southpark Psychology?
Well, there's so many of us, which is a wonderful thing. We have so many different specialities and interests. We do everything from testing to people that work with depression, bipolar disorders, specialize in anxiety disorders, trauma-based disorders, phobias, couples disorders, relationship breakdown, problems with children, adolescenthood, chronic suicidal thinking, chronic problems with working with children, parenting, addiction, chronic psychosis, chronic pain, looking after other people and the impacts you have on that. People suffering chronic medical conditions and the torment that can come with that also.
Wow, it sounds like you have experts that are trained to really address so many different types of mental health issues. Dr. Vincent, what are some red flags that you would say indicates that someone should seek professional help?
It's the level of distress that creeps into your life. I mean, people have problems. It's part of life. It's part of normal life. Things come our way. When does it start affecting you, your relationships, your work life, affects your life at school? When are you crying? When are you not sleeping? When are you barking at people? When are you not studying? When are you not going to work? When is it dominating your mind? When are you not eating? That's when you have to start thinking, do I need to talk to someone? When is it consuming me? That's the difference between a problem and something becoming a mental health event in your life.
In your experience, what do you think the main reasons are that people avoid seeking help if they are experiencing those red flags, but they feel some resistance to seeking professional help?
Some of it, a lot of it's a lack of understanding. Where is that line? Is it just a big problem, or is it I need some sort of professional help? So some of it's a lack of understanding. Then there is, what is this going to cost me? Is my insurance going to cover it? Then of course there is the fear. What will people say? What will people think? Is my problem really big, or is it really small? Also then of course the stigma. What does this mean? How will people look at me? And of course then there's also the consequences of it. Will this never go away? Will I be told I'm mad, insane? Will this be the path of a never-ending torment?
Wow, and you mentioned the stigma, and I think that talking about it and promoting mental health awareness is so key to breaking up that stigma, because we don't think twice about someone going to a doctor or to the dentist when they have an issue. I mean, even preventative or maintenance. You know, I go to the dentist twice a year and I might not even have a toothache, but I just want to make sure that I don't. And so I think that promoting this idea of, even if you're not necessarily going through something challenging, but having a therapist there or a psychologist, psychiatrist that you talk to regularly just for maintenance. I would love to see us get to a point where we treat mental health just like we would treating the health of any other part of our whole body. So thank you so much for bringing that up. But what do you think the potential consequences are of not reaching out for help when someone, their daily life is being impacted by these issues?
Well, like all medical events, the danger is things just get worse. You know, if you don't deal with something, it can just get worse. B, it just doesn't go away, so it just lingers, lingers, lingers. C, it can go away, doesn't mean it can't come back. You know, so those are the three predominant events. You know, gets worse, it just lingers, goes away, but comes back. So those are the three dangers.
Now, Dr. Vincent, you mentioned one of the reasons people avoid seeking help is because of the fear. And that may be stemming from because they have if they've never been to seek help, they have no idea what to expect. So for someone who has maybe never been to a therapist, counselor, or psychologist, what can they expect during that first meeting? You know,
one tries not to be overly clinical. You know, you try to engage in a very sort of casual way. You know, one presents as a doctor, one presents professionally, but you know, you draw in people via conversation by being very open. Tell me what's going on. You talk about what the patients have jotted down, but also you don't just rely on a few sentences on a piece of paper. You know, most people's experiences that present are very humanistic, very normal. Most of us have heard it all before. You know, the patients have heard it from other people. They're all very normative, and that's what you try and come from. These are stories of people's lives. So many of our problems interrelate. We've crossed over them, and that's what people can expect. And then you start to formulate with the patient some sort of picture what is going on.
And when you're working with patients, how do you assess progress, that they are actually getting better?
So progress does not happen from one session to another. Progress can take time. Sometimes people regress, sometimes people plateau. But fundamentally, people should be getting better. That's the whole idea of any form of care. So sometimes it's strictly behavioral. I did this, this, and this week, where a few months ago, no chance. And of course, I'm less depressed, I'm less anxious, I am getting out more, I'm not isolating myself at the weekend, I'm not crying all weekend, I'm not, my best friend over the weekend is not 4 bottles of wine. So sometimes it's very concrete things, sometimes the things are far more subtle.
Now, Dr. Vincent, it's hard to miss the skyrocketing numbers of suicide rates and just mental health disorders in our country. So why do you think that spreading mental health awareness is so critical to perpetuate this movement and see those numbers come down?
Well, again, you said it, despite so many advances in care, we have far too much suicide. It's increasing despite good medications coming onto the market, despite the expansion of mental health care. Access remains a problem, but changes in society, changes in culture have not been able to be affected positively by the growth in the field. We have not got these things under control. We have to get the word out there. We have to deal with access. We have to keep pushing people's understanding of care, what the care really means for them, and it's accessible all over the place, and it does work. This service works.
Absolutely. Well, thank you so much for being here today and for the part that you're playing in getting the word out and helping people. We appreciate it.
Thank you.
All right, you guys, for more information, you can call Southpark Psychology at 309-797-2900. We'll also have these details posted on ourquadcities.com. More Living Local continues after this.